Hi, my name is Dr. Hannah Park, and I am a podiatrist at Wildfoot and Ankle Institute. I have a specialized training in pediatric podiatry, and today I'll be talking about pediatric flat foot. So, what is flat feet? This is when the inside of your foot, which we call the medial longitudinal arch, that completely collapses when you bear weight on your foot. So your arch area will disappear once you are standing. It's very important to know that the fat pad on the bottom of children's feet is very fatty, which can make the arch look like there's no arch. So it's really important to understand that flat feet is very common in the first decade of life. This is commonly written about in medical literature, such as Dr. Stali and his team in 1987 even said 54% of 3-year-olds of children have flat feet. And then this percentage decreases with age. So 26% by age 6. So it's very, very common. So there's many different causes of pediatric flat feet, such as equinus, which is tight Achilles tendon, loss of a spring ligament, which is a ligament in the medial aspect of your foot. There's also something called genu valgum, which is when there is knock knees as well as internal tibial torsion when the tibia is turned inwards as well. There's also limb length discrepancy. If one leg is longer than the other, the foot can have an appearance of a flat foot on the long side. There's also different genetic collagen disorders that can contribute to flat feet as well. And ligament laxity, as well as even Down syndrome, there are patients with flexible flat feet also. So some of the things that we look for on a physical exam on a weight-bearing surface is we look at the back of your heel. We look at whether there's an angulation at the back of your heel compared to your leg, if it's straight versus if it is turning outwards. This lets us know whether the severity of your flat foot deformity. We also look for whether you have a rigid flat foot or a neutral or varus flat foot in terms of your flexibility by having you actually go up on your toes and seeing where your heel is standing. We also look at where your toes are at from the back of your heel to see how much of your forefoot, which is more of your toes and your midfoot, is going out compared to the back of your foot there. We also look at if there is a prominent navicular as well. Another thing we look for is if there's Achilles tendon tightness, and this is how we kind of assess for where your tightness is with your knee extended versus knee that's bent, okay? So that's something we'll look for, and that'll also help us in terms of our treatment as well. So some areas that you will have pain in if you have this pediatric flat feet is in the medial aspect of your foot, such as the medial column that is completely collapsed and dropped. Also the navicular tuberosity, which is a bone in the middle of your foot that's very prominent. Also the talar head, as well as some metatarsal heads that can be painful as well. And then the sinus tarsi, which is on the lateral aspect of your foot near your ankle. And then sometimes you can have pain in the plantar fascial area. So we will most likely have to get X-rays if you are having a symptomatic flat foot. For children, less than 1 year old, or even less than 6 years old without any symptoms, I usually don't get X-rays. But if you are symptomatic and you are having limitation in your activities, and you're not playing sports normally or going out for walks with your family, that's usual, then and then also if you have a rigid deformity, then we will definitely get X-rays. And these are some of the angles that I look for and evaluate in terms of how deformed or how flexible or rigid your flat foot is. And some of the treatments I do want to talk about that we do, depending on your exam and where you have the flexible flat foot, is one thing is doing stretching. Stretching actually is known to help quite a bit in flexible flat feet. It's funny because we say flexible, however, there is a tight component of your Achilles tendon that can contribute to having a flat foot. So we'll send you to physical therapy as well as have you do home exercises. Of course, there are orthotics, over-the-counter orthotics that can be beneficial. There's not a lot of medical literature supporting this. However, a lot of patients actually do feel pain relief from it in our practice. So that is one of the things we will recommend. There's also a custom orthotic, a very commonly one we use is called a UCBL, which is a little bit stronger. Also, as you can see in this picture, the sides on the inside as well as the outside, as well as the back of your heel is a lot more raised. That's really to reduce the amount of collapsing of your arch and to hold that heel, to hold your flat foot deformity. There's also something called a supramalleolar orthosis that can be used, especially in patients who may have ligament laxity, Ehlers-Danlos, or a very flexible flat foot that needs more support than a custom orthotic. Surgery, of course, is our last option that we want to do, but there are lots of surgical options there depending on your deformity. We try to do everything conservative prior to having the discussion for a surgical procedure. This is a list of surgical techniques that can be done. One or more of these procedures can be performed depending on the deformity that you may have. I believe that children should not live with foot pain, nor should they be limited in their activities. Children should be able to run, play during recess, and go on long walks with their families. So please come on in and be evaluated today.
What are signs of flat feet and how do they affect children's day-to-day lives?
Signs of flat feet that you should be looking for is when they are standing, the arch of their foot completely disappears. Also, if they are having a callus on the bottom of their foot in the arch area, as well as pain or swelling. And of course, if they are complaining of pain or limiting their activities, it's usually not typical for kids to not want to play with their brothers and sisters or their friends. So that's pretty unusual and definitely a big red flag.
What happens if flat feet are left alone?
If flat feet is left alone, if they are symptomatic, then it can worsen over time. It can also become rigid, can cause arthritis in the future, and cause more pain. However, if it's non-symptomatic and they have flat feet as children, it can go away in time or may not go away the way it looks. However, if they're not symptomatic, I would not worry about it.
What's the usual duration of treatment prior to a positive outcome?
Duration of treatment most of the time is at least 3 months. At least 3 months of trying a over-the-counter orthotic, and at least 3 months of trying a custom orthotic, depending on the deformity and the severity of the deformity. But I would definitely say trying conservative treatment for a prolonged period of time for at least a couple of months is very important for us to do before we ever jump into surgery.
How often should inserts or orthotics be replaced?
That really depends on how active the patient is. And their activity level in terms of, are they running, playing soccer, or are they just walking around? So, but I definitely think it is important for you to see a podiatrist or a doctor every 6 months to make sure that the arch support is fitted and not completely collapsed.
What types of shoes should you avoid if you have flat feet?
If you have symptomatic flat feet, you should definitely avoid flat shoes like Chuck Taylors, Vans, flip-flops that have no support. that would probably add on to more pain in the future. Thanks for joining us for this webinar. I hope it was very beneficial for you. Please come on in to one of our 20 locations to be evaluated today. Thank you.